believe absolutely passionately that we must have universal health care.
And we need walk-in clinics, and we need community health care. And
we don't want children, who I meet all the time, going to emergency rooms for treatable illnesses like asthma.
With the ongoing national debate now about health care,
hi, how are you?
There is a desire to move the nation's focus to primary care, to preventive care, care that is more timely, preventative in nature, and vastly more affordable.
The federally qualified health centers like Open Door just play a pivotal role in organizing the healthcare delivery systems. The fact that we're able to keep patients out of emergency rooms, that we're able to be a primary care home for thousands and thousands of people. I truly believe that this is a model for the future.
We diagnose the ailments at an early stage, prevent them if we can, through lifestyle changes, diet, exercise, weight control. It's all about getting the patient to a healthier state.
I want to have you come back and see me to see how your blood pressure is in a few weeks.
Little by little, one patient at a time, we're able to change the profile of the community. We focus on health and wellness, and what does health and wellness mean? It's about taking responsibility for your body, for your family, and using all of that in laying down a solid foundation in the community.
The outreach program is actually really important in the community because individuals really get to know what the Open Door is about and what services they can access at the Open Door. The mobile unit actually goes into the 4 communities that the Open Door is located at, and we really build relationships with the members of the community. How else do you guys think HIV can be transmitted? They talk to our HIV staff about anything that's health related, and we make sure that people know what we do.
When we go out into a community and do an assessment of who's in the community, who's providing services, what's needed, we work very closely with public officials and community partners. And then we design our services, tailor fit them to be able to address the needs that are there.
When you're trying to better the health of a community, you have to be ready to take care of everybody. We're blessed with a demographically diverse community, different languages, lots of different types of folks, lots of different types of cultures. And it's a challenge, it's an opportunity, it's something we embrace on a daily basis. It's part of exactly what Open Door does.
So can you explain that?
We all learn from one another how connected we truly are, regardless of our socioeconomic status. We all live in the same place. And that's why we have a moral obligation to care about the least among us. And in order to have a thriving community, we need a healthy community.
If we had electronic medical records, we would save $77 billion a year.
That way we will have a healthier nation and we will have less health care costs. But
if we want to invest in electronic medical records, then we've got to go to rural hospitals and say, we're going to help you.
There are thousands of health centers all across the country, and what's so terrific about our model is we share and we exchange and we all learn from one another. One thing that's so very exciting is that many of us have electronic medical records. Open Door was actually at the first wave of medical records implementation.
One other thing I'm going to do now is make sure that we have your medications listed in here.
An electronic medical record brings some sense of order to the chaos of medical practice. You have all the information about the patient at your fingertips.
So over here you're going to show the history of the patient.
It's visible by all members of the care team, legible. By definition, it cannot be lost like a paper chart can. It's better individualized care, but it also translates into a much better healthcare system.
Now I have colleagues from all across the country calling and want to learn from us. How did we do it? How much time did it take? What about the patients as we were implementing? And I'm sure that we'll play a really important role as the nation thinks about what healthcare could and should look like in the future.
Are you drink soda? This is how much sugar you're drinking.
We provide quality care when it comes to how well we take care of folks. You speak to your physician, and he knows everything about you. And he's not just there to take care of your cough, your sniffles, your headache. He's also going to make sure you're getting all the preventative care you need. That's what a medical home's all about. It's taking the concept of medical care to the level where we all want it to be.
We have our protein from our meat and all these fruits and vegetables that are so healthy for you.
Our facilities are so much larger than they were way back when, and yet there's something very special and very true to our founding in the basement of the First Baptist Church right behind me. The sense of commitment, the sense of passion, the sense of wanting to make a difference right here in the community. I think that all stays the same.
The health centers are the safety net. They are run by dedicated professionals. People are welcomed, they're respected, people get the services that are first rate. So you can't do any better than what you have right here at Open Door.
Straighten out your arm. I'm able to just practice medicine the way I was trained to, the way I hope it will always be. And I find it a privilege and an honor, frankly, to take care of these people. It's a joy. It's what sustains me. It's what rewards me.